Hello everyone, I'm Kibin Alleyne and today is Tuesday, May 28th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Montefiore School Health Program has been providing medical, mental, and community health services to K-12 students across the Bronx for 40 years. This is just one aspect of their overall mission to heal, teach, and advance the health of the communities they serve. Director of the Montefiore School Health Program, Rosy Chhabra, joins me to discuss this effort. Rosy, thank you so much for joining me.
Thank you for inviting me.
Now, can you provide an overview of the Montefiore School Health Program and its mission?
Sure. Montefiore School Health Program is the largest school-based health program in the country, and proud to head it. Montefiore is very dedicated to the community and really wants to kind of support the community in every which way, and Montefiore School Health Program is one of the steps that Montefiore has taken to do that. We have been in existence for about 40 years, and our program spans we have 33 health centers at this point, and as you know, in the Bronx there are multiple schools in the building, so if we are in the building, we support every school in the building, and we serve about 100 schools currently with close to about 38,000 students.
Wow.
So it's a big program. The comprehensive nature of the program is great because we are able to provide medical services, mental health services, dental services, community health, and something new that we started last year, which is a very important service, vision services. So for that, the kids can actually get screened and examined, and with our partnership with Warby Parker, they even get free glasses for the students.
Wow.
Yes.
That's amazing.
And our mission is to provide comprehensive care, health care, to all public school students in the Bronx. That's the goal, that's the mission, and regardless of their ability to pay. So every kid can access, anybody who is enrolled in the school can access the care that we provide in the health center.
Now, what makes this program, or what sets it apart from other school-based health programs?
It's Montefiore, so. But the reality of it is the comprehensive model that we have, which is evidence-based, and we really have kind of honed it over the last 40 years. So the comprehensive aspect is that we have mental health, medical, dental, vision, community health, all integrated. The integrated comprehensive model that we have is very unique to Montefiore School Health Program compared to others. And the other part, the second part that makes us very different is the innovative service aspects that we have. Our services change and adapt and grow based on the need of our community. So we are very much part of our community, so we listen to our school administrations, our parents, our community members, our students, and kind of bring the service or innovate our services to kind of really dynamically change and support the students that we have in the schools.
Now, how does the Montefiore School Health Program ensure accessibility and convenience for students utilizing these clinics?
The most important part is we are part of the school, right? We are in the community, we are part of the school, but we have like full service health centers. So a student can access the health services in the health clinic at any time that they're in the school. As we know, most children spend majority of their day in the school system. So here we are in the schools, and one of the biggest aspect is we utilize health literacy for these children. So now it's not only K through 12, we actually go to 3K through 12. So there are 3-year-olds coming in the health center as well for care that they might need. So we are teaching them how to access health care all the way from when they're very young. So that is the greatest aspect of what we do in the classrooms. And we go into the classrooms anytime, starting from the registration process into the school. We reach out to the parents, we reach out to the students in the classroom, at the health fairs, at different parent-teacher conferences, and we introduce the services that we provide. Because these are the services that have no out-of-pocket expense for the parents. So the students are in the schools and they can access through the day. Many students, I believe, even wait the weekend sometime on Sunday. They're, I felt sick a little bit yesterday, but I was waiting to come in the morning, and 8 o'clock they're standing right outside the health center to access the care. So that in some ways the trust that they have in the providers and the fact that they will be taken care of when they walk in, it's like on-demand care for them when they walk in, and any of the services that we provide. So that's the good part, and that's how we make it very accessible. And also whether they have insurance, whether they don't have insurance, whether they are immigrants, whether they have no copay. So none of that matters. When a child walks in, we take care of them. So that's the good part. And parents don't have to take any time off, and they don't miss seat time in the school, and the parents don't miss work time. So I think all of that kind of makes it very accessible for the students.
Now, something I really want to talk about that I was surprised to see, but very glad to see, is that there's also access to mental health services, which is so important and can, oftentimes be very expensive. Can you talk about the importance of, having, kids have access to that? And, what are some ways the program tries to destigmatize just the idea around prioritizing mental health?
So I think the goal that we always have is of overall health, and that is what we talk about. That is what our health centers are. They are integrated service program, right? So when a child walks in, we look at the wholeness of the child, and we provide all the services that are part of that. And mental health is one of the services that we offer. And when we are in a health center, we really try to go outside of the health center, go to the parent-teacher conferences, go to the classrooms, and we make awareness, and we make it more normal to talk about mental health. That is one of the aspects that we do very well. And the other part is our mental health providers go into the classrooms and introduce themselves and talk about different issues that are affecting the students these days. And I think children tend to go to people, not I think, the research shows that children tend to go to people they know. And this is what we want to do. We want them to be familiar with the healthcare providers that we have in the health center, so that there's less stigma. And when they walk into the health center, they could be walking in for any services. For mental health services, we also try to engage parents with us all the time, so that it's the whole system that is working for the student. And the services are confidential, but at the same time, I think talking about it and just seeing more information about it outside in the school and the community and with their parents sort of normalizes that for them, that if I need help, I can just go and talk to somebody. I know this person, I've seen this person, I've met this person, so they can kind of do more of that. So that's how we kind of try to create more access. And at any time they're upset or something, they can walk in. Sometimes they have a fight with their friend or something. They will walk in and they say, can I talk to somebody? I'm upset. And that makes me happy. That means they know that they have people that they can trust and they can go to talk about it. So that is how I think the accessibility, the fact that they can walk in even without an appointment and we will see them, that I think that makes it easier. And the fact is that they don't need an adult with them to take them to any of those places.
Right.
So.
Now, I saw this and I was very surprised to see it. There's also dental services. How do you provide that, and how are they integrated into school settings?
So again, the same integrated program. The dental service is like a very important part of what we do, and the dentist actually does more preventative work right now. Since after COVID, we have kind of focused more on preventative, and what that means is we do the exam, the cleaning, we do the fluoride, we do the sealants, and we also kind of talk about oral hygiene. And many times the dentist will kind of talk in addition to those things as well. And in the health center, because it's so integrated and everybody's there, there's always a warm handoff. So if sometimes the children is talking to the dentist and they figure out that maybe they might kind of be able to utilize medical services or mental health services, they will do a warm handoff, like walk the child over to another provider, say, oh, this child is here and this person would like to hear more about the services we offer. Can you talk to this person? So I think in that sense, we kind of create a very integrated approach to care. So dental services is one of the very important services that the children might not get anywhere else, but we are able to provide that, and we do a good job of it.
And I just want to add that I think it's so amazing that this work is being done, on campus in the schools, because as you mentioned, sometimes we have parents who are just very, very busy, and it also gives, the children the opportunity to kind of take charge in their own health. And so I think that's pretty amazing, and I love to hear that it's starting even in pre-K. Looking ahead, what are some of the goals for continued growth and impact in the coming years?
So I think like we have started some new service models that we're working on, but the biggest impact is I think we have a very big footprint. Montefiore does. We have like close to about 54 outpatient settings that a child can go to once they're enrolled with us. So it's not, there are like about 22 community settings and 33 school-based health centers that they can access. So our goal is to kind of reach as many students and as many children in the Bronx community that we can. And at present, looking at the mental health crisis, we are about to open about 5 new mental health care centers in the schools. It might not be possible to open up the full service centers everywhere, but the 5 new mental health centers will be opening within the next couple of years. And we have about 8 full service health centers that are being built right now to kind of increase our reach into the community and support as many children as we can.
Oh, that's amazing. So would you say that mental health services are kind of at the forefront of, especially when it comes to our youth and kind of making sure that they feel, I guess, safe and supported? Because as we know, many children are suffering, or, dealing with the challenges of mental health. So would you say that's maybe one of the major goals and challenges facing?
Yeah.
Okay.
That is actually what kind of prompted us to kind of really think about this carefully and kind of go after this grant that could kind of help us open up more healthcare centers that are focusing on mental health. And the OMH mental health that we're going to be opening, that has more wraparound and more higher level of services than a regular mental health provider can provide. So this one has more support for the families. They have more social determinants of health kind of issues. We can support with those. So there's like a lot more services that come with just these standalone mental health centers that we are trying to build. In addition to not only having a mental health provider provide therapy, we also have psychiatrists who can kind of prescribe medications if the child needs it.
Wow. Well, I want to thank you so much for joining us and sharing more about the work that you do to support kids in the Bronx and throughout New York City. But I just want to thank you so much. I think it's amazing work. So thank you.
Thank you for the opportunity. I'm happy to share that.
To learn more about the Montefiore School Health Program, please go to the website montefiore.org/school-health-program. Don't go away. We'll be back with more Open after this.